good morning, everybody. This is Brittany Jennings coming to you live from the Seniors Blue Book. And this morning, I'm joined by Dr. Olsen from Bluestone Physician Services. Good morning.
Good morning.
How are you today?
Good. How are you?
I'm doing fantastic. Thank you so much for joining me today with our new segment that started here in 2021, which is Doc Talks. And we're identifying different topics that are very relevant and helpful for caregivers and providing resources such as Bluestone provides to clients in different communities. Talk a little bit for a moment about Bluestone and the services that you provide.
So as a provider for Bluestone, I get to go into the assisted living facilities and memory care units, which honestly is a pretty big honor, because for facilities that aren't allowing family members and friends in, the fact that I get to go in and reassure these patients that, there is someone that, that they can relate to and talk to, and that we still care about them, even though that they're kind of in these facilities all by themselves. It's a pretty big honor to be able to go in, and we basically just see them at least once a month, if not more often, and take care of some of their most common medical conditions, chronic conditions, things that they would otherwise have to leave the facility to go be seen in a doctor's office for. We come and see them in person.
And it's been huge, even in the past, for the services you provide. I know because I used to work at a community and you guys were one of our providers. So it's a huge benefit to that resident, but also during a year of COVID, I mean, it's been a huge thing for these residents to not have to be able to, we're eliminating the places that we go, right? So the doctor's office, it's a huge benefit for somebody who lives in a community to use Bluestone Physician Services. So thank you for providing that information. Well, I want to dive into the topic today with you, Dr. Olsen, and have you educate us on the 3 most common infections and ways to identify those early. So,
that's a really good question.
Absolutely. And that was me handing the reins, like the invisible reins, over to you, the microphone. So I'll let you take it from here. Thank you so much.
Perfect. The 3 most common infections that I see in the ALF world are really urinary tract infections, pneumonia, and then skin infections like cellulitis. And honest to goodness, an infection in general can present with kind of an increase in confusion, increase in fatigue, fever, hallucinations, loss of consciousness, changes in vital signs like the blood pressure, even just vomiting and diarrhea, just an overall kind of change in the person. And, the differential, again, it could be infection, it could be other things like the thyroid, it could just be progression of their disease, it could be anemia. Obviously, if there's a huge concern, just take them into a physician and they can help. But as far as simple things that you can catch for these things at home before going in, with UTI, which I see quite a bit, it's known kind of like the great pretender, because it can present like a lot of things, but typically people have some pain when they urinate, either burning during the entire urination or kind of a spasm right after they finish urinating. Foul smell, cloudy urine, increase in frequency of the urination, feeling like they haven't completely emptied their bladder. Sometimes you can get some pain in the lower back, because that's actually where the kidneys are situated. So if the infection has gone up into the kidneys, you can get some pain there. I think one big confusion point is that people think, I'll just run to the grocery store and get some of that azo, which turns the urine orange. That helps with the symptoms. It's kind of like taking Tylenol, but not taking anything to help with the bacteria. So I just wanted to make sure to clear up that kind of common miscommunication. With pneumonia, usually we'll see some shortness of breath, a lot of coughing, wheezing. They might complain of kind of some chest pain, chest pressure, because you get a lot of irritation in the lungs with pneumonia. But big things to keep in mind there are a lot of the person's history. So pneumonia can present a lot like a COPD exacerbation, even if they don't have a history of smoking. Sometimes they can have like a pulmonary fibrosis, or there's lung cancers that present without any history of smoking. If there's swelling in the lower legs accompanying the shortness of breath, that could be like a congestive heart failure. Big things to look at with the legs, and that kind of ties into cellulitis too, is, is the swelling in both legs? Is it just in one leg? Because if it's just in one leg, it might be a clot, and then you can get some shortness of breath if that clot from the leg goes up into your lungs. There can be an allergic reaction. Maybe there was a bug bite or a new medication or a new food. And key things for that are, swelling of the tongue or the mouth, the lips. Also, there's a type of pneumonia that is caused by aspiration. And big key things to look for with that is, coughing with liquids, because usually they have more trouble swallowing the liquids first than they do the solid food. So if a caregiver's noticing that they're coughing more when they try to drink liquids, that may be a sign that, we might be needing a swallow evaluation to prevent like an aspiration pneumonia. Then the third one that I see a lot is cellulitis. And again, that goes back to if you notice kind of warmth, redness in one of the legs, that could be a cellulitis, especially if there's like an open wound. If the redness is expanding, that's a big concern. Sometimes I tell people, just draw around the redness with a pen or a marker. And then if you notice that redness is expanding past that marker, well, now you know it's expanding and probably an antibiotic is indicated. If there's drainage, and then again, if it's both legs, now we're looking at, well, maybe it's just edema. Maybe there's, some heart issues. And then, kind of aside other infections we see, we see some GI infections. And one of those is actually C. diff, Clostridium difficile, which can be caused if we've recently put the person on even just one antibiotic, but it's more common if they've been on several different antibiotics recently. And that's just a lot of diarrhea. There's a very distinctive smell to it, but really some indicators should go off if there's been a lot of recent antibiotic use, and then profuse diarrhea.
Awesome. Those are definitely, working in the senior living world and seeing, like you said, that initial first one was that cognitive change. I know, from working in assisted living, we saw, many residents who never even saw symptoms of that urination where it would burn, or, some of those things that we would normally feel like at our age, at their age, they didn't even know. It was just this quick, abrupt change in their behavior. They were acting completely different, or they were more confused, or, from somebody that, their baseline. So I think that's an interesting point to maybe elaborate a little bit more on, or what are some of those things that you do see when somebody starts acting a little bit differently? Is it just that level of confusion, or is there some other symptoms or behaviors that you see?
So I've seen the full range of the very first symptom we get is someone has a loss of consciousness, to I've had people that they just act differently, like they lose a motivation. Like I've had people who just decide that they just don't want to get out of bed, and so they just sort of honestly urinate in the bed because they just don't have the motivation to get out, or they're just confused about that's where you go to the bathroom. And even hallucinations, like I've had women that see bugs, or like cats. So again, UTI is that it's the great pretender. It presents like so many different things, and it can be very scary. And it turns out all it is a simple antibiotic to treat the UTI, and the person's right back to normal.
Absolutely. I actually had, when I worked in assisted living, I had a lady who stayed with us for a respite for just about 30 days. About 2 weeks in, she started calling her family member and saying that there were rats in her room. And so, of course, initially like, oh my gosh, like what? So we obviously investigated the whole thing, but I said, you know what, let's get her lab work done. Let's check this out. And that was what it was. It was that she was having those hallucinations. So I think that's a really great point, again, to bring up. So thank you so much.
Yeah.
So any last words that you would leave for people as we kind of close out this information?
I don't think so.
And we
I
can
guess
cut this part out. I just didn't know if there was any last words of wisdom that you wanted to leave.
I guess just, I would never be afraid to ask a doctor. You know, I have people that they're so apologetic. I'm so sorry for coming in, and, you know, maybe this is nothing, and I'm sure it's nothing. But I mean, that's what we do, and that's what we love to do. And that's why we're in this line of work, you know, because we would much rather have that conversation when it's early and easy to treat than let it progress. And, you know, now the cellulitis has turned into a sepsis where, you know, the bacteria is in the blood. You know, same with a urinary tract infection. I would much rather catch it in the bladder than have it go up into the kidneys. Or, you know, a pneumonia. I would much rather catch it early than have someone come in and then have to intubate them, you know? So I would just, if I wanted to leave everyone with anything, it would be, you know, don't worry, just come in and we'll chat about it, you know?
Yeah, be proactive versus reactive.
Right, exactly.
Thank you so much, everybody, for joining us. And we do want to say we are happy to be in 2021, and we will see you twice a month for Doc Talks. Thanks, Dr. Olsen. Have a great day.
Thank you. Bye.
Bye-bye.